Indeed, the vast majority of breast cancer cases are sporadic, which basically means there is no genetic reason for the development of cancer. However, in about 18 to 20% of breast cancers and a bit more in ovarian cancer, we know that there is a genetic alteration that predisposes women or men to develop cancer. And particularly in women, this is breast or ovarian cancer. And this can be nowadays tested with a simple test. It's basically a blood test, or it can also be a swipe from the mucosa that can basically determine whether you are at high risk and whether a particular kind of early detection program would be appropriate for you. It is very important to know your mutational status. So if we do know that the mutation is present, you have the possibility of an early detection program, but you can also undergo preventative surgery. And when it comes to preventative surgery, it's the removal of the fallopian tubes and the ovaries. And in terms of breast cancer prevention, it is the removal of breast tissue. Both can be done. Both reduce your risk considerably, but they are not without side effects. The removal of the fallopian tubes, and particularly the ovaries, is associated with early menopause and also with a decrease in bone density. And the removal of breast tissue, although it might appear to be some kind of a beauty surgery, is very often associated with considerable side effects such as chronic pain, inflammation, etc., etc. So you have to be very careful when you decide whether you want to undergo preventative surgery. An alternative is participation in an early detection program, which starts at age 25. We recommend MRI, annual MRI at age 25, and then every year thereon, and also mammography at age 35. We also offer transvaginal ultrasound at age 35 and tumor marker assessment, which should also be initiated at around age 35. But these are only measures to detect an already existing cancer. There is now another alternative which allows you to prevent breast cancer and possibly also source of cancer as well. And this is a drug that is being tested in clinical trials all over the world, which is a preventative injection that is given every 6 months and that prevents women with a BRCA1 mutation from developing breast cancer, potentially also from developing ovarian cancer, and it also augments bone density, so a very valid alternative for those who have not undergone preventative breast surgery and who have a BRCA1 mutation. Well, it is very important to look at your family history to see whether in one part of the family, either the maternal or the paternal side, you have several cases of breast cancer, particularly young women who have developed breast cancer. Also, the combination of breast and ovarian cancer is highly suggestive of a mutation. And you can then undergo a test, which is either a blood test or a mucosal swipe, which is easily being performed, it's not painful, and you have a result within a couple of weeks. And you can then find out your mutation status and clearly identify the risk that you're at. Well, there is genetic counseling offices probably all over the world. This is a test that's being offered in many, many places. You have to be very careful where you undergo testing, because some of the labs only analyze parts of the genes, particular mutations. But if you want to have a comprehensive view of potential genetic alterations in the breast cancer genes, and there's not only 2, there's in the meantime 16 to 18 breast cancer genes, you can do so in a certified lab. And as I said, it's a simple blood test.